December 31st, 2019. Throughout the world, celebrations began to welcome us into the year 2020. For thousands of years, billions of people around the globe have come together to celebrate the occasion. While our traditions may have changed, it has always been an event to remember. Whether you watched the ball drop in the middle of Times Square or got together with your friends on a rooftop bar, it's common to know when and where you were each year. And it turns out, going into 2020, it would be the last normal day we would have for a while.
My first experience with the COVID pandemic really started before it even got here to the hospital. It felt like it started a few weeks while we're just seeing what's happening in Italy, we're seeing what's happening in Spain and China.
In medicine, we are always fighting a silent enemy, but it's an enemy that we know. We recognize death's grip on our patients, whether it's a devastating decline of a patient with fluoride septic shock or the unavoidable decompensation of a patient with liver failure. We have studies, we have data, and we have knowledge, and therefore we have power. Even if it's just a little.
It was like being afraid of a monster that was in a closet. You could only hear it. You could only imagine what it looked like or what it sounded like. And then finally the monster was here and we could see it.
Everyone just didn't really know what to expect. It's a very unprecedented type of situation.
I could not get any rest. Will my patients be okay? Will I be okay?
There were a couple of my team members. They kissed their wives or their husbands, and they kissed their kids goodbye, and spent several weeks, several months in their basement and had limited contact with their families.
Telling family members that we were about to intubate their loved one, and having to relay to the patient what the family member wanted them to hear. It's tough. And I think the fear, I'll never forget the fear in some of the patients' eyes. And that was not something that we encounter on a run-of-the-mill intubation.
There's all the emotions of, hey, your family member is likely not going to survive this hospitalization, but you can't come into the hospital. I think that was the biggest struggle for me.
Humans are not meant to be alone. Humans are meant to be able to hold hands. Humans are meant to be able to have family by their side and have voices that they recognize. And they don't have it. They still don't have it. Right out there, there's a unit full of patients that don't have any family or loved ones or people that they know or trust or they know their voices. And that comfort not being there is immeasurably hard.
We face critical illness head-on with our knowledge like a seasoned war general, developing strategic plans of attack that give our patients the best shot at making it through. Our knowledge is our armor, but we don't know this. We have no power. Suddenly, our job became dangerous.
We had to come together and begin to start from scratch, because you would have thought there was some playbook, some blueprint how to deal with this. I mean, crying out loud, they've made movies about this type of thing, but unfortunately there was no such playbook.
We started seeing other medical communities in the country start to get under siege, and so it became increasingly apparent that we were going to need to ramp up our preparation efforts. Immediately, the entire leadership team, our hospital CMOs, our division leadership, the System Incident Command Center, our Piedmont clinic leadership all began trying to protect our patients and our teams the best we could.
Our mission became, how do we streamline communication to our providers who are taking care of these patients on the ground, on the front lines?
I think our team relied on the evidence. Now, there's not a lot of it. Trying to just glean anything that they could to make the best decisions.
We quickly realized that this was behaving very differently. And in fact, when we started to share information and collaborate, and certainly using a lot of the information and data from Italy, we were able to evolve.
We've always prided ourselves on being a very collaborative division. And so we worked very closely with the internal medicine service, infectious disease, cardiology, because we overlapped a lot with them in the cardiovascular ICUs.
At the end of the day, COVID did not care about what you looked like, how much money you had, who you were. And so that required a sense of community to really deal with this. And we undoubtedly could not face this alone. So many different areas, so many disciplines coming together, putting their minds together so that we can have one collective approach to this. There was clear collaboration between members of the Piedmont Clinic Advisory Committee, the Quality Improvement Team, and the Pulmonary and Infectious Disease Clinical Governance Councils.
Collaboration is what we do. Saving lives is what we do. We were now having to focus on it at a system level, sometimes operating on data that was changing minute by minute. The division leadership took on tasks such as staffing protocols, surge planning, and ventilator preparedness, and reviewing the daily onslaught of research on this new disease.
I would characterize our response as inspiring. Our team organized themselves into what we considered COVID response teams, and actually were very instrumental in leading the healthcare system in critical care staffing, ventilator management, COVID treatment protocols, and research protocols. You know, Chad Case loves to organize, so he had this room here filled with a bunch of big sticky notes denoting the different groups that might be needed to help craft the response.
We were really focused around ventilators and the supplies needed to ensure that we didn't run out of that equipment. We were focused over the potential need for surge staffing and how we coordinate that across multiple hospitals in a seamless way to stretch our intensivist resources to provide critical care specialty coverage to every critically ill patient for as long as we could.
We literally drew up a plan for war against this unseen enemy within the course of a few weeks, and we did it to scale across an 11 hospital system.
Critical care staffing led by Curtis Coley, ventilator management, allocation, and strategies led by Ryan Carrick. The science and treatment team was led by Amy Case. The communication team, which was pivotal, was led by John Heisler. And it was amazing to see all of our providers and our leaders come together in an evidence-based way to really focus on how to improve the care of these patients, how to protect those of us caring for the patients, and how to do everything in an evidence-based fashion. So we still have a lot of efforts ongoing in treatment algorithms and being part of research protocols. And while the critical care staffing and the ventilator allocation efforts have been kind of laid aside, what's great about that is that provides a framework for anything that happens in the future. We can pick that back up, and we've learned from the experience that we've had.
Throughout this pandemic, our pulmonary and critical care team stepped up to the plate and responded. Whether that was at the bedside in the hospitals, or in the clinics, or in the boardrooms making decisions on how Piedmont dealt with COVID-19, our team never failed to step up to the challenge.
A lot of my reading said to surround yourself by people that were smarter, brighter, and more capable than yourself on a daily basis. I've been fortunate enough to do that. I learned a lot from them and have enjoyed watching them lead this response.
I'm extremely proud that we were the frontline clinicians, from the APPs to the doctors, more so on a daily basis than any other physician in our system. We all played a role, nephrologists, internal medicine physicians, ER physicians, but the day-to-day, everyday response and continuity of care was provided by our service line.
We were doubling, tripling ICU censuses. Our division immediately stepped up. In an environment of no or I don't know, our division turned it into yes and I'll find out.
There were no other people that I could imagine myself going into battle with. The attention to detail that my coworkers had, the preparedness that my staff had, the leadership from administration, I mean, from the top on down. We spoke with one voice, we followed one direction. Our leadership was second to none.
I was on the phone with countless others at other health systems and other hospitals, and it was chaos for those people. It became very evident that what was put in place at Piedmont was as highly organized, efficient, and effective as anything that I had heard. And in fact, better. It wasn't completely utilized or expressed because we never got to those Armageddon levels. I am quite certain that Piedmont would have been ready.
When we look back over the course of this pandemic so far, there have been members of our division participating in work groups and projects at every level of the organization from the very beginning. Our executive leadership team in particular deserves tremendous credit for not only representing our division to Piedmont Healthcare, but in turn helping to represent Piedmont Healthcare to our community here in Atlanta and in this part of Georgia.
The nurses, respiratory therapists, and staff at Piedmont have been nothing short of heroic. They were the ones with all the PPE on all day, living out their patients' anguish and triumph. Our providers endured a lot and managed it without complaint. And for that, we say thank you.
The nurses in the intensive care unit and on the COVID unit here in the hospital deserve tremendous credit for their daily effort to make our care of these patients as human as possible. I don't think it can be overstated how brave, how heroic, you want to use the term heroism. I think the nurses and the respiratory therapists deserve that honor more than anyone else. I don't think it's appreciated enough, the kinds of things that they were doing. They're doing things like holding people's hands, talking to them, giving them updates on what's going on in the world, putting them in communication with their families, just being there and having that human connection.
Honestly, I think more than any other medical provider, nurses have borne the brunt of what's happened, aside from the patients. Doctors get a lot of credit, but I feel that the most amount of credit, if you wanted to put it in a hierarchical fashion, should be to nurses. They're the ones exposed to bodily fluids, exposed to secretions, bathing these folks. I've seen our nursing colleagues just essentially collapse from exhaustion.
Especially all the nurses on the 6th floor. They've been amazing, just had wonderful attitudes. They've been the ones spending the majority of time taking care of these patients.
I think one particular group that doesn't get as much credit is the respiratory therapist. They're right along with us when we're intubating patients, when we're managing ventilators.
Watching every single one of them, without question, like going in and out of that room multiple times, having perhaps even more anxiety than what I was having or what other people were having. They just did it. It was remarkable to watch them just sling through the mud, no questions asked. I just respected them so much for every single thing that they were doing.
We certainly don't think COVID-19 is over. This is the end of the first phase. We embraced the unknown and we added structure to the chaos. And this is what we do. We don't know what the next phase will bring, but we do know that we can handle it.
I think our community still needs us. We got to keep fighting. The way I see it, there's no time to rest, unfortunately. It's not over yet. We just got to rest as much as we can and keep doing the best we can every day. We're all in this together. I think it'll be a season that has been painful, but also it'll be something that we can look back on and say we pulled through this as a team.
To a certain extent, it doesn't matter if we have a second wave because we now have a plan.
Now having a better perspective, and I think we're much more prepared. I think we would know how to handle it. And so I think if we do have another wave, we're going to be okay. We will be ready.
Our journey started in March, and now it's the last day of June, and our attention has turned from fighting the pandemic to thinking more about recovery, reopening, and many of us worrying about a second surge of COVID. I would like to take this opportunity to thank the tireless efforts of our nurses and our respiratory therapists. They've been involved in the daily battle against this virus from the onset, and their work has been nothing short of inspiring. I would also like to recognize Charlie Brown and the Physician Enterprise for their leadership during this pandemic. Their ability to get testing centers operational in a very efficient manner and to help guide our recovery efforts have been very impressive. Finally, I'd like to recognize the efforts of Kevin Brown and his corporate leadership team. Many healthcare systems throughout the country have cut thousands of jobs, but Piedmont Healthcare has managed this pandemic in a patient-centered and fiscally responsible way, thereby minimizing job losses.